So good evening, everyone. Thank you so much for joining today's programming. I would like to first read the land acknowledgement. The University of Illinois Chicago College of Pharmacy is standing on the traditional territories of the three Fire peoples, the Ojibwe, Odawa, and Bodiwadi tribes. Now I would like to pass it over to Marisol. Thank you.
Thank you, Hitomi. Hi, everyone. Thank you for joining us today. My name is Marisol Wences, and I am the president of the Hispanic Latinx Pharmacy Student Association. And we're excited to be co-sponsoring this event in celebration of Hispanic Heritage Month. Other sponsors of this programming include the Office of Diversity, Equity, and Inclusion, the Black Pharmacy Student Association, and SNAFA. This program is approved for Flamestreaming 4 credit, KY, and PDC points, as well as PLS credit. And the attendance is going to be shared towards the end of the presentation. There's also going to be an opportunity for you guys to ask questions. So if you do have any questions throughout Dr. Cuellar's presentation, just drop it in the chat and we'll be sure to answer them at the end. So without further ado, I will present our guest speaker. Dr. Sandra Cuellar is a board-certified oncology pharmacist, a fellow of Hematology Oncology Pharmacy Association, and a fellow of ASHP. Dr. Cuellar is a clinical associate professor in the Department of Pharmacy Practice here at the University of Illinois at Chicago College of Pharmacy, and a clinical oncology pharmacist here at UI Health. Dr. Cuellar received her PharmD degree from the University of Illinois at Chicago College of Pharmacy, and she then completed a pharmacy practice residency at the University of Kentucky Chandler Medical Center. Following her residency, she completed a specialty oncology residency at MD Anderson Cancer Center in Houston, Texas. Dr. Cuellar is the director of the Oncology Residency Program, member of the DSMC, and co-chair of the IRB at UI Health. She is also an editor at large for Journal of Hematology Oncology Pharmacy and an invited lecturer of national and international pharmacy organizations, including HOPA, ASHP, ACCP, ACCC, FIP, and AMCP. And with that, we welcome Dr. Cuellar.
Thank you, Marisol. It's a pleasure and honor to be an invited speaker for this important month in recognizing Latino, so Hispanic Heritage Month. I'm going to just say a little bit in Spanish just because it is Hispanic Heritage Month, but I promise this is probably the extent of my Spanish for this presentation. Quiero darle las gracias a ustedes por invitarme hoy. Es un placer y un honor estar aquí con ustedes y tener esta oportunidad de hablarles sobre cómo vine a ser una farmacéutica y mi carrera como ser farmacéutica. So muchísimas gracias. So without further ado, the title of my presentation is Hablemos, Let's Talk, Academic and Clinical Perspectives of a Spanish Bilingual Pharmacist. So just an overview of today's presentation. I have the opportunity to go through my background. It is, again, National Hispanic Heritage Month. And so it's an opportunity for me to share my background, my Hispanic background, and I'd love to share that with you today. And really talk about my pharmacy journey. I know Marisol, did my quick bio, and but really share of how I started in pharmacy. And then finally kind of conclude with my academic and clinical perspectives, being a bilingual Spanish pharmacist for the span of my career, which is close to 20 years now. So what is my background? So my parents and my ancestors are from Mexico. My family specifically, and it's highlighted here in this map, are from the state of Nuevo León. My mother was born in Los Garzas, which is a small pueblo near, it's actually the nearest city is Monterrey. Los Garzas, it's about, the population in that pueblo is about 200 people. Nogales is a town where my father is from. It's a near pueblo near Los Garzas, and that has a population of 300 people. So this is where my mom and dad were born, in Nuevo León, Mexico. I still have family there today in Los Garzas, primarily in Los Garzas. My sister lives in Monterrey, Mexico, which is the second largest city in Mexico. And I'm taking my children there in Thanksgiving because my father is actually buried in Los Garzas. So my children have gone to Monterrey, but they've never had the opportunity to go visit the pueblo where my mom was born. And actually the pueblo where I used to spend my summers as a little girl. My mom would send me to be with my grandparents, and I would be at the rancho with the chicken, the chicken house. And it was just all this, just very colorful childhood experiences that I had in Mexico. In 1961, my father left that small town of Nogales. He married my mother and shortly left my mom in Mexico and came to Texas and to the United States. He was in Texas for a short time and then decided to move to Illinois. And we ended up residing in Chicago Heights specifically. So they married. He found a home and brought my mom over to Illinois. My mom had my sister back in Mexico because they didn't have insurance. So my sister was born in Mexico. And then by the time my other sister and myself, were born, they had insurance. So I'm actually a first generation American. So I'm born in the United States, but my heritage, obviously my background is from Mexico. So it's very important, I think. So the first language, as you can imagine, being first generation in Chicago Heights. Chicago Heights was a town that it's not what it is today in Chicago or any other big city in the United States. It was primarily Italians and Mexicans were there, but it was a small number. I remember my sister, my eldest sister, experienced some actually discrimination. So we weren't powerful in numbers by any means, and we didn't have a lot of family here. So as you can imagine, the only language I learned growing up was Spanish. So Spanish was my first language. I didn't learn English until I was in first grade. I think it was a lot of Sesame Street, a lot of TV, maybe some neighbors were involved. And my mom put me obviously in school, but I didn't have fluent English until I was in first grade. And with that, so Spanish is my first language. Learned English in about first grade, I would say, at least fluently. And translation became a big part of who I was as a child and growing up. And that's why you kind of see these images on the side, is because oftentimes I would have to translate for my mother. My mother had, spoke very little English, and understanding English was a challenge for her, especially if there was a medical appointment or any other appointments that she had or exchanges with non-Spanish speaking people. It was always a struggle. So as a little girl, I remember very distinctly translating for my mother all sorts of things and communicating on her behalf. As I grew up, that continued. That continued to be something that I did oftentimes with my mother growing up. Once I became a pharmacist, I started to do this as a regular part of who I was as a pharmacist and what I did. When you think about translators and the technology 20 years ago, there just wasn't the same technology that there is today. So oftentimes I found myself translating. So Spanish has been something that, obviously it's my language, my first language, but this whole idea of translating and communicating has been with me since I was a small little girl. So how did I become a pharmacist? My parents immigrated from Mexico. My father ultimately became a business owner and also did, house rentals as his source of income. So in my immediate family, I did not have anybody in the medical profession. My mom had limited education and was a housewife up until my father passed away in a tragic car accident at the age of 4. And then at that point, my mom had to join the workforce. But really, I didn't have anyone in my immediate family, like I said, to have a role model. He's like, why did you pick pharmacy, Sandy? So how it happened was there was career day at my high school. So I was a junior in high school, and the juniors and seniors got to select up to 3 careers and professions they were interested in. And when I was in high school, and I wasn't the minority, I wanted to be a physician, a doctor. My mom, since I was very small little girl, very much pushed education, studying. And so I was a good student, an honor roll student, National Honor Society student. So I was committed in investing in myself and in my education and moving myself forward. And so I selected fields in medicine. So I remember selecting physical therapy and physician, and I think the third one was nursing. And so when it came to the designated days, because I was a junior, all the physician spots were taken up by the seniors. So what the organizers did is, well, like, okay, well, she's interested in medicine. Pharmacy is a medical field. Let's just put her in that career day because that had lots of spots open, but still was in the medical field. So even though I was like, I didn't know what a pharmacist did, I didn't know what a pharmacist was about, I was inadvertently put in that career day session. 2 pharmacists presented that day. I remember distinctly. One was a retail pharmacist, the other was a hospital pharmacist. And they shared what their jobs and careers and their profession was. And I was surprised, I was excited, I was interested in potentially finding out more. So that was like my first time exposure to pharmacy, was inadvertently getting placed in a pharmacy career at career day at the high school. I decided, I did well in high school, decided to go to a small liberal arts college. I did not want to go to a big school where I was 1 in 200 for chemistry and biology. I really was attracted to going to a smaller school. So I went to this small liberal arts college in Rock Island, Illinois. Here, again, not a lot of Latinos. There was probably less than 50, I would say, on campus. It's a Lutheran college, private college in Rock Island. So not a huge population of Latinos there. At Augustana, I was still interested in the medical field. I was still deciding between medicine and pharmacy. I decided to become a pharmacy technician there, and then ultimately decided that that's what I was going to do. Did my pre-pharmacy work there, applied to UIC College of Pharmacy, and I remember the day I got the envelope that I was accepted. And that was, again, another monumental day in my life, is getting that acceptance letter from UIC. So I started my career at UIC College of Pharmacy. Again, if I reflect back, the number of Latinos in my class, again, I would say less than 5, maybe. There was definitely no Hispanic organizations back then. At UIC College of Pharmacy, again, I was very devoted to my studies. My mother was very proud of the achievements of graduating from college and now in a doctorate program. Again, I was one of the first in my family to make it this far. At the UIC College of Pharmacy, I decided, okay, I'm like, where can I take this? And I was so inspired by the faculty at UIC. I was inspired by the clinicians. I was inspired by the opportunities that I had in hand. And I sat there thinking, because back when I was in pharmacy school, there was a shortage of pharmacists and there was a lot of incentives to go to retail. And when I mean incentives, there were some pretty hefty economic, monetary incentives to go into the retail setting. But I sat and I reflected and I thought to myself, I can just go into retail, or I can, sacrifice another year, not make that money, because the money, that carrot was there, but I can invest in myself. I look into the opportunities of being a clinician and what other opportunities that can bring to me. And so because of the faculty, because of the clinicians on my rotations, I decided to pursue a PGY1 residency. I decided to go to University of Kentucky because of its premier status within the reputation of college, oncology, not oncology, but pharmacy in general. University of Kentucky has a prestigious pedigree of other clinicians that come out of that program. So I was fortunate enough to be selected to be a PGY1 resident there. There, once again, if I were to look at the healthcare professionals and pharmacy, or even my co-residents, I again was underrepresented in a minority there. But again, that's what made me special, right? So I went to University of Kentucky for a PGY1. University of Kentucky had really solidified what I had identified as a pharmacy student, which was my interest in oncology. I decided to go to Texas, and fortunate again was selected to be a PGY2 resident at MD Anderson Cancer Center, which is probably the most prestigious or second most prestigious cancer institute in the United States. And it was one of probably a highlight of my career, is being able to work with the most famous hematologist oncologists with cutting edge medicine at MD Anderson. So I was in Texas for a year. After that, I had the fortunate ability to be recruited back by our former dean, Jerry Bauman. There was a position open at UIC. I had expressed an interest of coming back to UIC, and I wanted to go back to academia again. I felt that I wanted to be that inspiring faculty member and share my experiences and teach. I really enjoyed teaching. I taught at the University of Kentucky. I taught at MD Anderson in both of my residencies. And I felt like that was something that I wanted to do. And in addition, I felt like it was an opportunity to really be that Latina pharmacist. When I looked at the faculty, in all these other, at Augustana, at UIC, there was two faculty that I recall that were Latina. There was Eva Vasquez, she was a transplant clinician, and Mariella, she was infectious disease. And both of them were very much very inspiring to me. And I wanted to be a part of that. I wanted to continue to show the visibility of Latina or Hispanic faculty at the College of Pharmacy. So I was fortunate, there was a position that opened the ambulatory care setting. And that was 18 years ago. After my residency, I arrived at UIC, my home, back to my home, I feel like, and I've been there ever since. So I've only had one job after my residency, which is UIC. And this year was 18 years. And I anticipate that I'll be here for another 10 years, probably. I'll probably retire from here is the way it goes. So that's kind of my pharmacy path. And as I reflect back, looking at, what did it mean for me, again, being bilingual in Spanish, this has been an integral part of who I am as a pharmacist. So as a student, I will tell you, again, then you have to keep this in reference point. This was, close to 20 years ago, right? I was on my P4 rotation with Rakesh and Mike Piscini, who recently retired 2 years ago. I think Mike Piscini retired. They were my preceptors. And I was on, it was supposed to be a medicine rotation, but all the medicine rotations were taken up. So it was like oncology, but oncology medicine rotation. So then again, that was another accidental, inadvertent, I don't know, maybe it was meant to be, but I was on the oncology rotation, even though it's supposed to be my medicine rotation. And on this rotation, we were rounding on, and we had this Hispanic patient, Spanish speaking only. And the team consisted of an attending, a fellow, a resident, medical interns, pharmacist, and then me, the low man on the totem pole. I was the pharmacy student. This particular patient was admitted to the hospital, and it was, they needed to communicate with him and let the patient know what was going on. And so quickly they recognized that I was bilingual and spoke Spanish. And so right there, being a P4 student, I had to communicate to the patient that he was diagnosed with head and neck cancer, that we would be removing some, if not all, of his teeth, and that we would be placing a G tube for his nutrition, and that he would be starting a treatment called WOWO. That was the name of the regimen back then, WOWO. WOWO was week on, week off chemo radiation. And I will tell you, as a pharmacy student, that I was afraid. I had so many emotions, as you can imagine, having to translate this devastating news to this patient. Absolutely devastating. From you have cancer to we're going to remove your teeth, that we're going to place a tube in your stomach so you can eat. Absolutely devastating news. But I've been down, I've had experience in communicating and translating. And so I sat down and provided that information. And in response, this patient was just so grateful and thankful, because up to this point, he had no idea what was going on, because our communication with him was extremely limited and he just wasn't understanding what was going on. So although I was delivering this devastating news for the patient, he was, obviously shook by this information, but finally felt like, okay, now I know what's going on. And that feeling is, that doesn't erase, it stays with you. And let me tell you, it continues. So as a resident at University of Kentucky, once again, a similar scenario. We're doing our inpatient rounds. This time, at Kentucky, there's not a huge Hispanic population, but there is quite a bit of migrant workers that work in the tobacco fields. So this was another patient that was admitted to the hospital. And with this patient, it was, I was identified as being able to communicate with him. And I had to communicate that he had HIV and he had an HIV-related infection. That was another difficult experience. But once again, the patient was very grateful. He had a lot of more questions that he was able to ask me, and I can get information to talk to his family. And so that was another experience. And in Texas, of all places, Texas, you think like Texas has a disproportionately probably higher rate of Spanish speaking people. True. But in the medical profession, not so much. So even in Texas, my bilingual Spanish skills came into play once again. This time it was on the lymphoma service. I had a patient who was diagnosed with Burkitt's lymphoma, one of the most aggressive lymphomas, if not the aggressive lymphoma. And this patient was from San Luis Potosí. And I thought to myself, where is that? I had to go to the map in Mexico, like San Luis Potosí. And in that scenario, it was the wife. It was the wife that I had daily conversations with. She had a list of questions for me. We talked back and forth. And it was, again, something that, it stays with you, the ability to be able to communicate. Yes, I'm not only communicating medical information, but obviously also the pharmacy part of everything that I do. And as a clinician, I'll tell you, just yesterday in clinic, we had a patient who, a young patient in her 40s, who was just diagnosed with cervical cancer. She is from Venezuela. And at the point that I saw this patient, okay, now we're in 2021, and she had already spoken to the attending, obviously talked to the nurse practitioner. They used Ivan. They had, had all the conversations. And now I was doing the chemo counseling and the take-home meds and kind of coordinating her medications and her appointments and things like that. And so as soon as I introduced myself, it was a sigh of relief that finally I have someone face-to-face I can talk to directly without a translator. And there was some sense of relief with that. I had a student and a PGY1 resident with me, and it was palpable, the sense of relief that this patient had, because I was able to communicate with her. And that's something that I can't emphasize enough, is how, communication in general is so important, but especially in the medical field, and even more so when you're dealing with oncology patients. So, I have this experience of being a bilingual pharmacist. I call it my superpower. I feel blessed and honored that I'm able to use this skill that is obviously so natural for me, and to talk to patients in their natural language. And it has really impacted me in so many ways. So what are my clinical perspectives? So we know, and I don't have to tell you this, that the number, if you look at the census numbers, the number of residents who speak Spanish has increased dramatically. Some statistics say over 300%. So there is an increased demand for bilingual pharmacists, bilingual healthcare professionals. When we look at Hispanics, comprise of 18% of the nation's population, but yet when we look at the pharmacy workforce, some of the statistics say that less than 5% of the pharmacy workforce are Hispanics. The most recent numbers, I was kind of curious, and what are the numbers most recently of Hispanics graduating PharmD degrees? In 2019, 847 Latinos graduated with PharmD degrees. That is compared to 7,400 Caucasians, 1,200 Blacks, and about 3,800 Asians. So Asians and Blacks are also minorities as the Hispanics, but we're definitely underrepresented. We need more pharmacists in the workforce. We need pharmacists in the workforce, or bilingual pharmacists, so we can communicate to our patients probably the most critical thing in managing their health, which is medications. And there's lots of data. I'm not going to bombard you with data about Latinos and Hispanics and communications and barriers. I'm not going to bombard you with that, but there's a huge need of bilingual pharmacists. So what have I seen? So I've been working in pharmacy for 20 years, and I have seen some positive trends and trajectories that I'm so happy. And at UIC alone, when I started here 18 years ago, we had very limited bilingual staff, from MAs, nurses, the whole spectrum of UIC. And now I see, at greeting at the table, or even the people in our financial office speak Spanish. My MAs speak Spanish. I think almost all of my MAs speak Spanish. So the staff has increased, and that in and of itself is a positive direction, because as soon as they identify a Spanish speaking patient, they could talk in that native language. So I think that has been positive, and I think UIC needs to be applauded for their efforts of hiring more bilingual staff, and recognizing, I think the UIC, the UI health population in Spanish is about 17% or so, maybe a little bit higher, but recognizing and hiring to address these issues is a big achievement. Being sensitive to language barriers, I think that is another critical component that I see and I've witnessed as a clinician, is, when patients, it's not only Spanish. In my practice, I see Polish, I see Russian, Mandarin, albeit to a lesser degree, but, language barrier is a challenge. It's almost a handicap if they don't understand they're at a huge disadvantage. And I think that we have to be sensitive and recognize what tools do we have, what can we do to overcome this barrier. And so here, obviously, I have, whenever possible, recognizing, hey, we need to provide this information in Spanish. I can't tell you, how many times I'm counseling a patient who's Spanish speaking only, and the medicine bottle is all in English. So inevitably, what that patient does is writes with a pen the directions on the label, and it's like all scribbly, and I can't even read what it says, but because they can't understand what's on the label. And I think there's opportunity for us as pharmacists to recognize, well, how can we overcome this? What's a quality improvement we can initiate? If we see a Spanish speaking, at that intake, should that be identified? By the time I get it, the patient doesn't want to wait. They don't want to get it relabeled. It's such a hassle. They're going to wait another half hour. So there's opportunity here for us as pharmacists to recognize, what can we do? What can we do to make this better? Medication education. This Venezuelan, this patient that was from Venezuela who just spoke Spanish, her son who speaks English wasn't with her. He had dropped her off because he had to work. And then the nurse provided the information on the treatment in English. And so I just took a pause. I said, okay, let me get this for you, because the folder is already the folder of the medication name and information and numbers and other information is already prepared ahead of time. And so we had to swipe it out for Spanish speaking information. I think, again, it's a little bit more time, a little bit more effort, but the patient is completely appreciative of that. Communication tools. Again, I think this is one of the advancements I've seen in being in the health, the health force for the past 20 years in Kentucky and Houston and here in Chicago is we're getting better. We're recognized. I'm no longer allowed to translate because I'm not a certified translator. So now there's rules and regulations against me translating. And not that I do it as much as I used to, but we have Ivan and we have, certified translators. But obviously there's times when I am still doing it, and I don't mind doing it. I'm not one to shrug my shoulders like, oh, fine, I'll go translate for you. I'm always like, absolutely, whatever you need, I'm here. Yes, because I know what it feels like from a firsthand basis with, being a translator for my mother. And I continue to take my mom to all of her doctor's appointments, and I continue to be her advocate, and I continue to translate for her and keep her attuned to what is going on. And I think that is so vitally important. Academic perspectives. So given my background, my life, my career, I recognize the need from a firsthand basis of needing bilingual pharmacists. So when I was at University of Kentucky, Dr. Robert Kuhn approached me and said, hey, Sandy, I think your residency project should be to create a Spanish elective, a Spanish for pharmacists elective. And this was during my residency. He's like, we have this migrant population. This has been a big issue. I think this would be a great project for you. And so myself and Dr. Shelley Grimm was an infectious disease faculty here at UIC, but she was my co-resident at Kentucky. But Shelley was bilingual. Her Spanish was actually pretty good. So Shelley and I created this Spanish elective, and we taught it at University of Kentucky. So that was my first experience was at University of Kentucky. Once I came back to UIC, it wasn't immediate. I started at UIC in 2003, but it wasn't until 2011 until the Spanish elective, I became involved in the Spanish elective. And again, it was not something that, I had thoughts of doing it, but as many you can imagine, so many things in my life were going on. I was a part of it. At that time, I didn't feel like I had the resources to start a course. And so this came from actually an Hispanic student had approached another pharmacist who I don't know if you know who she is, Dr. Suzanne Solomon, or Dr. Rob. She used to be a rabbi, but Dr. Solomon, she's now, she was, I think, a keynote speaker for this program in the past. But he approached Dr. Solomon and said, I think there's an opportunity here for this elective. And Suzanne immediately, contacted me and said, hey, Sandy, there's this opportunity. Are you interested? And I'm like, absolutely, absolutely. I would be a part of this course. And so we designed this Spanish elective in 2011. And again, really, for me, it was something that I was continuing something that I was already very much familiar with, something I was very passionate about, and knowing there's such a huge need for this. So the goals of our electives was to demonstrate Spanish speaking pronunciation, state over 30 healthcare terms in Spanish, communicate in Spanish using complete sentences, greet and obtain personal information to a Spanish speaking patient, like what is your address? What is your phone number? What kind of insurance do you have? What are your allergies? Just general and personal information. Interpret information from a computer, provide patient and accurate directions for medication use. I think that was something vital that we really wanted to make sure our students could do after the conclusion of our course. And then we also decided to integrate cultural aspects of Spanish-speaking individuals. And I think that is, again, another component as you interact with Spanish-speaking patients, is understanding the different backgrounds and cultures that patients who speak Spanish have. You have Mexico, you have Venezuela, you have just so many other Central American and Southern countries that have different cultural aspects. And we felt like that was something that was important to share with our students, so they're aware of it. There's awareness about what are their thoughts and ideas about herbal medicine and medication in general, and really making that a part of the course. With the first year, we did have a very assertive and very outgoing pharmacy student who was really wanted to take this and share it and make a publication about it and do kind of a small study. So this student, we did an assessment of pharmacy student attitudes and perceptions on a team-based learning in a Spanish elective course. So the way we designed the course was on a kind of a team-based learning, method. And so this team-based learning method kind of consisted of students doing some outside preparation, some in-course individual and in-class work, online journal entries, peer assessments and examinations, mock patient interviews. And so students kind of work together in a group to kind of perform all these activities. And so when we looked in the literature to see if there was any data regarding team-based learning at a foreign language course at a college of pharmacy, there really wasn't anything. So we felt like this was an opportunity to share what UIC is doing. And you could see that's what the methods were. The course was offered in 2011 and 2012. And the data was primarily descriptive. So what was our results? So our response rate was, we had 52 students at the time we did this course. I'll tell you, we don't have 52 students now. We kind of cap it. I think we're at like 28, 30. I think we've capped our course. But 85% of the students said that the course enhanced their care to Spanish-speaking patients. And 90% of the students regarded teamwork and the team-based learning course to be the structure to be beneficial learning experience. So this was all very positive. It reinforced what we were doing, and we were trying to be a little bit more innovative in how to teach the Spanish course. There were some recurrent themes regarding the teaching method, that the course was flexible, learning opportunities, group interactivity, and it was applicable throughout the curriculum. And so this is how our course first started out. Again, this was in 2011 when we first started. This was the model. I'll tell you, our Spanish course today is still offered. As of 2 years ago, I stepped down from coordinator as I assume other responsibilities. I felt like this was something that I just was not able to continue to coordinate. So Dr. Carrizales, we we are core coordinators, and now Dr. Burgos and Dr. Carrizales are now coordinators of this course. I'll tell you, Dr. Carrizales and I did change the structure a bit where we made it completely online, where students had assignments where they would listen to our lectures, and their assignments, their verbal assignments, were they had to record themselves and turn in their assignments to us on a weekly basis. And we would listen to their Spanish and provide feedback, all via Blackboard. And so our course has been very popular. I'll tell you, every year we have a waiting list for our course. And I think what we need to do is reevaluate the outcomes. I think there's opportunities for outcomes and seeing, like, you know, our students, is this continuing to be successful? But again, I think it goes back to, you know, recognizing that, you know, we have a Spanish population. Not everyone's going to be a fluent Spanish speaker like myself, but can we offer our students a little bit more comfortability with the terms and try to communicate with our patients? And that really was the intent of this course. So I talked to you about my academic and my clinical perspectives. And I also want to share that, you know, it extends beyond that. And so that's my community involvement. And I will tell you, of the handful of Hispanic faculty at UIC, we all share in this endeavor of community involvement. All three of us, because I think that's all there is, myself, Dr. Carrizales, and Dr. Burgos, at least in the Department of Pharmacy Practice, we all are, you know, consistently, you know, are proud of our heritage and want to give back to the community. And so I participate, and these are just some examples of some of the community outreach efforts I've participated in: the Hispanic Health Coalition event, Vive tu Vida, Dia del Niño, the Latina Women Expo. Christina, Dr. Carrizales and I were invited speakers for that. The 16th Annual Legislative Latino Caucus Foundation Conference. I was also invited to the March of Dimes, Dia de la Mujer Latina. I was an invited speaker for that too, talking about pharmacy, talking about oncology and therapy. So I think that, again, I recognize that I'm underrepresented minority within my community of pharmacy. And I feel that I need to give back and do my part to really increase the visibility and hopefully really create more involvement, more awareness about who we are, and really hopefully encouraging that next generation of pharmacists. In addition to the community involvement, I think another critical component of advancing you know, healthcare professionals in the eye of the community is involvement in organizations. And one of the organizations, and I would tell you this is pretty recent, I have become a member of, is MOLA. MOLA is the Medical Organization for Latino Advancement. It's a nonprofit association of Hispanic physicians and healthcare professionals. Hey guys, that's us. Working for career advancement, linguistic and cultural competency, personal wellness, and health equity for the good of the entire Hispanic community. So this is their mission statement. This is what MOLA represents. This is what MOLA wants to do. And I think this is an excellent, there's a Chicago MOLA, a Chicago chapter, I should say, of MOLA that I'm a part of. Their conference is right around the corner. But just to kind of give you a taste and a flavor of what their conference topics are, again, for those of you who are interested in learning more about what can we do, right? Because part of it is we see what we are in pharmacy, but really looking this at on a bigger scale. Okay, so understanding key issues with Hispanic and health disparities on a local, regional, and national level, including the result of the COVID-19 pandemic. Identify evidence-based strategies to address gaps and barriers in Latino health and discuss options for implementation of best practices. Again, this is something that you can go to and get some concrete ideas that we can bring back to our practices. Describe innovative strategies that are being realized or proposed in current academic research, community practice, or educational development have an impact on improving Latino health equity. Discuss strategies in health policy or education that address increased equity and representation of Latinos in medical careers and other areas of health professional advancement. That's what HMOLA represents. That's who us here in pharmacy, we should be, I'm definitely an advocate of MOLA. I'm an advocate of these great topics that they're addressing that I think that we're continually learning about. So it's a great opportunity. There's other organizations, obviously the National Hispanic Pharmacy Association, HOPA, ACCP, and ACHP. And you're probably like, oh, Sandy, those are just pharmacy organizations. You were absolutely right. These are pharmacy organizations, but these are pharmacy organizations that are, again, where is a representation of the Latinos? I encourage you to really step up and not just be a member, but increase that visibility. That's what I'm here. Hopefully what you're getting out today is I'm hopefully motivating you to take your career, take that responsibility as for those of you who are Hispanic, to push yourselves to be leaders, to push yourselves to recognize who we are and what we can offer. And being a member is simply not enough. I'm not for HOPA. I have devoted myself over the past 18 years to these organizations and getting involved and volunteering my time in committees, in publications, in national presentations. And that's where I received the fellowship status that Marisol said. I'm a fellow of HOPA, I'm a fellow of ASHP. So that really is recognition of my contribution to those organizations. And I'll forever have those as a part of my title, because that's recognizing my contribution to not only pharmacy, but to that organization. So what are my words of wisdom? Spanish, for those of you who can speak it, it's your superpower. If you have it, use it. It's so important, and especially for our profession, and especially for our patients. I can't emphasize that enough. I'm going to encourage you to be a leader in your field. You are at one of the most prestigious colleges of pharmacy in the country. We expect that you show your leadership, show what UIC has created, showcase your skill set, and get involved. Because in order for you to get that visibility, get those opportunities, right? You have to get involved. And I'm going to put, what is it? That there's a saying, put your money where your mouth is. I'm not saying these words of wisdom. I'm living and breathing these words of wisdom. As my academic profession, I got promoted to associate professor. Again, I think, and I would love to know what the statistics are. I don't think there's many, more than 2 that I can think of, promoted associate professors that are Hispanic. I'm a leader in my academic. I'm the coordinator of 5409. I was a team leader on the hospital side. I was the team leader up until last year. From like 2006 to 2020, I was a team leader. And I was recently promoted from vice chair of IRB to the chair of IRB. So I am doing my best at every aspect of my job, and I'm seeking these leadership positions. Again, I'm the Hispanic, pharmacist. In the community setting, you've seen the health fairs. I've been an invited speaker. I, give my time to really pursue these opportunities. And in pharmacy as a whole, again, that fellowship status. I know what it takes to get that fellowship status, and I took it. Book chapters. I've published in 4 book chapters. I've done 9 international presentations and over 25 national presentations. And it's not that I'm bragging. It's just, this is what we need to do. I need to showcase, I need to show representation of Hispanics in pharmacy. I will tell you that when you look at me in the directory at UIC, my actual name is Puri, P-U-R-I. And P-U-R-I is my married name. I married, my husband's Indian, and so I did legally change my name to Puri. However, in my career as a pharmacist in any publication and in anything that has to do with my career, I go by who I am. And who I am is Cuellar. So I'm very proud of my last name. I'm very proud of my roots and where I started, where my dad and my mom started to where I'm at today. And I'm sure many of you out there have similar stories that I have and share. And I think those stories and those experiences should really fuel your passion and make you go further in life, invest in yourself, invest in the future, and really help others become leaders in their field. So I'm going to close with the oath of a pharmacist. And I close with this to remind us who we are as pharmacists. Yes, I'm a bilingual pharmacist, but when I look at the oath of the pharmacist, I take this vow, and I took this as a pharmacy student, and I remind myself every day when I go into work working with my cancer patients that I will consider the welfare of humanity and relief of suffering as my primary concern. I will apply my knowledge, my experience, my skills to the best to assure optimal outcomes for my patients, whatever it takes. I will respect and protect all personal health information. I'll accept lifelong obligation to improve my profession, knowledge, and competence. I'm a lifelong learner. I'm a lifelong teacher. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace advocate changes and improve patient care. I will utilize my knowledge, skills, experience and values to prepare the next generation of pharmacists. And that's what you guys are, the next generation of pharmacists. And with that, gracias. I will take any questions. How am I doing today?
Hello, Dr. Cuellar. Just wanted to say that was a great presentation. Everything was just very interesting and very motivated. So again, thank you for taking the time to talk about your life and your career path. So a couple of questions that we have for you is, what sparked your interest in oncology specifically rather than any other clinical setting?
Great question. So where did that start? So my interest, so I had a couple of interests when I was a pharmacy student. One was infectious disease, one was cardiology, and the third was oncology. And when I sat, so infectious disease and cardiology, I just love the therapeutics of it all. I just love the therapeutics. Rob DiDomenico was actually one of my cardiology professors. And it was something that I was interested in. For oncology, it was Dr. Linda Bressler was my professor. And her lectures were I felt like the oncology lectures introduced a whole different therapeutic area with drugs with a narrow therapeutic window that really necessitated an expert in that kind of area. Not to say you don't need that in other areas such as infectious disease and diabetes, but I felt like oncology was the therapeutic area with drugs with a narrow therapeutic window, and really because of that narrow therapeutic window and the potential of its toxicities, you really need a drug expert. You really need to count on a drug expert. And as I dove deeper into that therapeutic area, I realized that cancer patients become neutropenic. So there's my infectious disease passion. Then I realized a lot of my cancer drugs cause cardiotoxicity. And so then I was able to incorporate that aspect of it. So my interest was first started on my oncology therapeutics course. And then it really, I would say it strengthened in my P4 rotation with Rakesh and Mike. I had to do an in-service on trastuzumab. Trastuzumab, for those of you who don't know, is a monoclonal, the first monoclonal antibody biological agent that was approved in breast cancer. It's a remarkable drug that really changed the face of that particular HER2 positive disease. And it was the first biologic. And so I had to teach about this monoclonal antibody, this biologic, because we were so used to chemotherapy. This was a real paradigm change. And so I thought, oh my God, I'm teaching on this drug. No one knows about it. It's in combination with chemo, all things. And so I felt like, oh, wow, this is exciting stuff. So that's as a student. As a one, I had the grand pleasure of working with Dr. Val Adams at University of Kentucky. If you look at some of the pharmacy books, you'll see Val Adams' name. Val Adams is a remarkable oncology pharmacist. I have the pleasure, I'm actually co-presenting with him at the end of this month on non-small cell lung cancer. But Val really was someone who equally inspired me and probably further solidified that I should go into oncology. So I think it wasn't just like one thing that inspired me. I think it was something that hooked me. And then I had other experiences that really solidified it. And, I got into oncology when oncology was not sexy, because oncology is pretty sexy right now. I got in it when it was, toxic drugs that made you puke your brains out. And if you look at oncology today, there is no other therapeutic area. I challenge you to find another therapeutic area that has many drug approvals as oncology does, novel mechanisms of action and new drug approvals. No one has it. And you need a pharmacist. You need a pharmacist to be able to navigate all these new drugs, all these toxicities, supportive care management. And that's the other aspect that I didn't talk about tonight is I have, because of my experience and my publications, my research, and having an academic is that I actually do quite a bit of consulting work for pharmaceutical companies. I do a lot of advisory boards for pharmaceutical companies. I just did one for Amgen on biosimilars. I did one 3 weeks ago for IV iron. And I just did a talk today on a breast cancer drug. And I'm a speakers bureau for a number of pharmaceutical companies because I need to teach on these drugs. So, I went with my passion and with my passion with oncology and all of these drugs, there's a need for education on drugs. And there's a lot of nurses, pharmacists, physicians, fellows that need this education. And so it has been a decision that people ask me like, Sandy, how did you get interested in oncology 20 years ago when really everyone avoids it? Like, oh, anytime you say cancer, like people avoid it like the plague. And yet I was intrigued by it because I felt like, well, this is an area you do need a pharmacist is in oncology. You need to check and double check those chemotherapy orders. So I know that was a long-winded answer to your question, but hopefully it answered it.
It did. I just want to know if we had time for one more question. Maybe?
Can I, this is not a question. This is Dr. Awe. I really want to thank you so much for taking time to do this presentation. And one, please ignore my dog barking. Yes, you are the only Hispanic faculty member with the faculty title of promotion of clinical associate professor. So that's, in and of itself, a great achievement, and we need more. I think that we are going to make sure that faculty members and the whole college listen to your presentation, because we think you as definitely someone we should all know about. So thank you so much for this presentation.
You're absolutely welcome. And again, thank you for inviting me and allowing to share my journey and who I am today. And in part because of what UIC gave me, and this is my opportunity to give back. And so thank you so much for your kind words. I appreciate it.
Thank you.
Dr. C, do you have one minute time for one more question?
Yeah, I'm fine. Yeah, sure.
Okay, so Johnny, can you ask for one more question, please? Thank you.
Again, thank you for giving us extra time because you are just so empowering, and we just thank you. But the last final question we have for you is, are there any opportunities for students to shadow you or have you as a mentor for any type of research?
Ooh, that's a great, Johnny, right? Yeah. So I have had students, request to do research with me. It's just, I am so stretched thin with my clinical practice, being the director of the residency program, coordinating FAR 509, being chair of IRB. In addition to all of that, I'm working on, I have these other, obligations and responsibilities with, I'm chair and vice chair of this other, these other committees that at this time, I'm just not able to take anybody for research. But given the shadowing, I would allow a student to shadow me. Again, it's all based on timing and what my life is looking like. It's always a challenge for me because when I'm busy, like this week, I was only at work, for 2 days because I had to moderate this breakout. Just so many things. So I think it's like if you catch me at the right time, or maybe I could schedule it in the future, I could allow some students to shadow me. Absolutely. The research part is a little bit. At this time, I'm not able to at this time because I'm just. I'm just too stretched. I'm a mother of 3 too. So, so it's just so much to work-life balance. But, I do want to hopefully, be that mentor or be that role model to encourage you guys to really push the needle, push yourselves beyond retail and invest in yourselves and what other opportunities can come, not just academic, but just other opportunities that are out there. So great question, Johnny.
Great. Well, I think time is up. And again, Dr. Cuellar, thank you so much for your presentation. It was very encouraging, inspirational. And, this is recorded, so we'll be blasting it throughout the UIC campus, for our College of Pharmacy. So again, thank you everyone for participating. And Dr. Cuellar, thank you so much tonight.
Gracias. Besos. Adiós.